Hi class, in this lecture we will discuss vaccines. The objectives are listed on the slides and they're also listed in your Blackboard module. Please be familiar with the vocabulary for this lesson. So the purpose of vaccination is to prevent infectious diseases. And thanks to widespread immunization, several diseases have been reduced dramatically or even in some cases eliminated, such as the case for smallpox. Of all medical advances, none has reduced sickness and death more than vaccines. Now, the best way to reduce disease of vaccine preventable diseases is to create a population that's highly immune. Essentially, when you create a population that's highly immune, we create what is known as herd immunity. And this is protection from the spread of disease within that exposed population. And the people who are unvaccinated, because inevitably in any population, there will be some that just aren't able to be vaccinated. But basically, if you've got herd immunity, those few that are unvaccinated indirectly receive benefit from that immunization of the larger population. But for herd immunity to work, a very large percentage of the population has to be vaccinated in order to prevent transmission of disease. So this is known as the herd immunity threshold. So it requires that about 90 to 95% of the population be vaccinated. So let's talk about some definitions before we go any further. So first of all, vaccination. When we say vaccination, what we're talking about is administration of either a vaccine or a toxoid to patients. And this creates a state of immunization. Immunization refers to the production of active and passive immunity. And so we can have either active immunity or we can have passive immunity. In active immunity, in response to infection or in response to a vaccine or a toxoid, the patient becomes immune. And this generally takes weeks to months to develop. But the good thing about active immunity is that it has long-lasting effects. Passive immunity, on the other hand, is when preformed antibodies are passed on to someone else. Now, this is relatively short-lived because the immunity itself only persists as long as the antibodies are present. And so when we think of passive immunity, typically we're thinking of a mother passing on antibodies to the child. We could also create passive immunity by giving patients immune globulins. So immune globulins are preparations that contain high amounts of antibodies directed at a specific disease. And these are made from donated blood, and when they're administered to patients, they confer immediate passive immunity for that patient. But again, that immunity is only going to last as long as those antibodies last. So I already mentioned vaccines, and vaccines are used to create active immunity. Now, vaccines are preparations that contain either whole or fractionated microorganisms, and they cause the recipient's immune system to manufacture antibodies directed against that microbe. And vaccines are of two different types. They're either live attenuated vaccines. So these are vaccines that are composed of live microbes, but these microbes have been weakened or they've been rendered completely avirulent. And so we don't worry about the live attenuated vaccines causing disease in healthy individuals. However, in immunocompromised patients, these actually can be dangerous and they can cause disease. And that's because immunocompromised patients can't mount an effective immune response, even towards these organisms that are considered avirulent. The other type of vaccine is an inactivated vaccine. These are also called killed vaccines. And these are composed of whole killed microbes or isolated components of microbes that cannot cause disease in patients, even in immunocompromised patients. Um, so these vaccines can either have, like I said, the whole or a part of the organism, or they can be toxoids. Toxoids are actually vaccines where you have the toxin that's produced by the bacteria, but this toxin has been changed to a non-toxic form. But this toxin, kind of like the organism itself or the part of the organism, will cause the body's immune system to manufacture antitoxins. And these are antibodies that are directed at that toxin. And so, again, this creates a state of protection for the patient. So I've already talked about the different vaccine types, but let me go into a little bit more detail. So I'll start by discussing the live attenuated vaccines. So again, in these vaccines, the organism is avirulent, or it's considered to be low virulence, right? There's a variety of ways these are produced. It could be that the organism is serially passed through cultures to render it such that it's not capable of producing disease anymore. It could also be that a mutated strain that has a low virulence was selected from that population. So the advantages of live attenuated vaccines is that they induce mucosal immunity, and then this vaccination mimics what you would see in a natural infection. Disadvantages, these cannot be given usually to the very young, so usually during the first year of life. And also these, because they mimic they mimic the vaccination that's seen with the natural infection, um, uh, the immune compromised patients aren't able to mount an immune response. They can actually experience disease in these patients, severely immunocompromised. Some examples: the oral poliovirus vaccine, is a live attenuated vaccine. Rotavirus, varicella, intranasal influenza. These are just some of the live attenuated vaccines that are on the market. Okay, so the other type of vaccine that we'll talk about are the inactivated, also known as the killed vaccines. There are two basic types. I mean, these can be broken down to even more categories than what I have listed here, but for our intents and purposes, I think this is sufficient. So either an inactivated, either whole or subunit of the organism, or a toxoid. So let's talk about both types. So the inactivated, either the whole organism or the subunit of the organism, again, these are killed. So the organism itself is killed. And this is accomplished by treating the organism with formalin. The advantages of this type of vaccine is that they're very easy to make. And the most, I think the biggest advantage is that we have no risk that the organism is going to become virulent, or what the original wild type of the organism was, because these organisms are killed, or it's just a piece of the organism. The disadvantages, these can be reactogenic, and they can cause some local side effects, which can be problemsome. And also, they do tend to be less immunogenic than live vaccines, which means that the immune response can take longer to be activated, or the immunity that's created is less profound than what we might see with a live vaccine. Some examples: the inactivated polio vaccine, the hepatitis A vaccine are both examples of this type. All right, and the other type of inactivated or killed vaccine is what's known as a toxoid vaccine. So I already mentioned that in some cases the organism secretes a toxin, and the toxin is what is dangerous for the patient. But that toxin can be used to create the vaccine. So that toxin itself is inactivated, so that it can't cause disease in humans. Advantages: these elicit immune response only to the component of the organism responsible for the disease. and they are highly effective. So because you're using the toxin itself and not the organism, it's a more specific. It's more specific because it's the toxin that's causing a problem. Disadvantages: very reactogenic, so patients can have issues with these, and immunity can wane, and so that will require more frequent booster doses. Some examples: diphtheria and tetanus are both this type of vaccine. So some adverse effects. So these are general. This is a general discussion of adverse effects that could be seen with vaccines. I'm not going to talk about specific vaccines at this point, but just generally some of the things that we might see with vaccines. First of all, they're generally safe. Uh, for the most part, mild reactions are really all that is seen for the majority of patients who receive vaccines. So local reactions, some patients experience fever. Serious events associated with vaccine administration are rare, but they do happen. Anaphylaxis, acute encephalopathy, vaccine associated paralytic poliomyelitis, these things can occur. In fact, I'll be honest with you guys, I have children of my own, and I absolutely vaccinate them according to the recommended schedules. I get them flu vaccines every year, and of course, all of the different scheduled vaccines as are recommended by the CDC. But I'd be lying to you if I didn't say every single time that one of my children gets a vaccine, I'm worried. I am worried because I know I'm familiar with the serious events that can occur. But I'm also educated about the fact that they are very rare and that the cumulative, the overall risk of them getting a vaccine preventable disease, it's more likely that they're going to get a vaccine preventable disease if they're unvaccinated and have serious morbidity or mortality than it is for them to get a serious adverse effect from getting the vaccine itself. And so for that reason, I choose to vaccinate my children. Um, but I keep the whole picture in context that these serious events can occur. Luckily, they are rare, but they do occur. Now, since they do occur, there is a reporting system. It's called VAERS, which is the Vaccine Adverse Effect Reporting System. It's operated by the FDA. If you know of a patient that experiences any adverse effect from a vaccine, you should report it in this system. This is the system that's used to really look at epidemiologic data around vaccine use, post-marketing type data. So I would urge you to use this system if you are caring for a patient and they experience um, an adverse effect related to vaccines. In addition, there's a program called the National Injury Compensation Program, or the National Vaccination Injury Compensation Program, sorry. And this program was created to provide compensation for injury or death from vaccination. And really, the point of this is it's intended to kind of serve as an alternative to civil litigation with the drug companies. Now, I don't know that it always 100% works that way, but it's a federally funded program, and so for those patients that do, those small percentage of patients that do experience serious events, they can receive compensation through that program, especially patients who have serious morbidity that requires long-term treatment. They can receive compensation for that. Now, for all patients, whenever a patient receives a vaccine, whenever the vaccine is administered, it is required that they receive a vaccine information statement, or a VIS. It's a two-sided, it's very brief, it describes the risks and benefits of that vaccine. The one last thing I want to talk about, kind of as just a general discussion around vaccines and adverse effects from vaccines, is thiomersal. Thiomersal is an adjuvant that's added to vaccines. What an adjuvant does is that it helps amplify the immune response. There were initially reports that this adjuvant causes autism and other problems associated with that people have thought could be associated with vaccines. but there have been numerous studies that have shown there is no link with autism. Um, and so I think that's a really important thing to talk about. And I'll talk a little bit more about autism in a couple slides. Before I move on from here, again, I just want to reiterate these vaccines are considered generally safe. But, again, mild reactions can occur. Um, some patients, especially children, will experience uh, erythema at the infection site. They might experience swelling or discomfort, or the needle itself can hurt. So when the needle is when the medication is administered, the needle can be painful for especially for kids. So there have been things that have done to minimize pain associated with vaccines, because some people don't get vaccines because they're afraid of the pain or because they're afraid of a needle. So newer things that have come on the market over the years: needle-free devices, intranasal vaccines, the use of microneedles to minimize the pain, combining shots into one needle to every extent possible, things like that. Really kind of talking to the patient about their fears with a needle, things like that can be helpful to increase the number of patients that are vaccinated. All right, so I just wanted to give a little information about the autism thing. I imagine you might encounter questions regarding that. It is safe to say that there's no medical or scientific evidence that supports that vaccines cause or are even linked to autism. So let's move on to the contraindications and some conditions that are often considered contraindications that are actually incorrect. So this kind of applies across the board to vaccines. So there are risks with vaccines. As I mentioned, I talked about some of the severe adverse effects that can occur. These risks can be minimized by observing appropriate contraindications and precautions. Remember, a contraindication means that the drug should never be used in that population. So this is a chart from your book. I think this is important information for you guys to know. You'll be giving vaccines for sure, regardless of what setting you work in. And so just being familiar with this general vaccine information, I think, is important. So true contraindications, meaning the vaccination should not be administered. Obviously, if the patient has had a previous anaphylactic reaction to that vaccine or something similar, then they should not receive the vaccine. If they had, if they have a moderate or severe illness, with or without fever, then vaccine administration should be deferred. So it's not that they should never receive the vaccine in that scenario. It's just that we should wait until they get better before giving them the vaccine. Some conditions that are not contraindications, so the vaccine could be administered, so mild to moderate local reactions following a vaccine. So that vaccine could be given again. You might just warn the patient that they might experience swelling and erythema in the future. Mild acute illness with or without a low-grade fever. The patient has diarrhea, um, uh, current antimicrobial therapy, if they're in the convalescent stages of an illness, if the child is premature, um, recent exposure to an infectious disease, or personal or family history of penicillin allergy or nonspecific allergies. So I'm not saying that these patients shouldn't be evaluated a little closer before giving the vaccine. They certainly should. But just because they have one of those conditions doesn't mean that they are not allowed to get a vaccine. All right, so this is a list of the currently available adult vaccines that you might see. I am not expecting you guys to know all of these. This is really just kind of informational, some of the things you might see as you begin practice. The childhood vaccine list is similar, but there are actually quite a few additional vaccines on the childhood vaccine list. Like I said, when you have your pediatric health class, you'll learn more about the childhood vaccination schedule. The two I want to focus on are influenza and pneumococcal. These are the vaccines that have pretty strict recommendations, and their use is much broader than some of the other vaccines that you see listed here. So I'm going to go into a little more detail about those two. All right, so the influenza vaccine. This is an annual vaccine, so it's needed every year. Remember, this vaccine is constantly evolving. So the specific strains in this year's vaccine are most likely going to be different from the strains we see in next year's vaccine. There are several types of influenza vaccines on the market. I think you need to be familiar with pretty much everything on this slide because I know that all of you will be giving the influenza vaccine regardless of whether you work in the inpatient or the community setting. It's just such a common preventative measure that's used, that's recommended. So I'm positive that you'll encounter this drug. And I also am positive that at times you might get confused by this drug. And that's because there are so many different dosage forms available, or so many different versions of this vaccine available. There are nine, at least nine, the last time I checked. There were nine different influenza vaccines on the market. In your book on page 1119, there's a chart. You can take a look at it. There are several versions on the market. The chart shows who each of those different versions is approved for. So there you go, right there. Be careful when you are about to administer a vaccine, one of these vaccines. Most likely, you're going to obtain it from a refrigerator that's either on your unit or in your clinic. And in that refrigerator, there's going to be multiple types. You might see 3 or 4 or 5 different influenza vaccines in that refrigerator. So you have to be pretty knowledgeable and make sure you choose the appropriate type. Not only that, when the prescribers are ordering these, whether they're handwriting the order or the prescription, or whether they are ordering it from an electronic system, it can be very confusing which one to order and what exactly to write. Again, if it's a handwritten order, what exactly to write to make sure that the person who administers the vaccine administers what you intend. So my bottom line here is be very careful with the flu vaccines. Make sure you're familiar with the different types of vaccine that you carry wherever you are employed, and make sure you know who gets what, essentially. So there is an inactivated influenza vaccine. Most of the influenza vaccines are the inactivated type, and these are either administered intradermally or intramuscularly. There is the live attenuated influenza vaccine. This is only administered via the intranasal route. The brand name is FluMist. And this is contraindicated in certain populations because it's a live vaccine. So, adults over 50, kids less than 2, immunocompromised patients, patients with certain chronic medical conditions, pregnant women, or patients with a history of GBS. And actually, let me tell you, patients with a history of GBS, both types are both types of flu vaccine are contraindicated in that population. So just kind of actually cross that out on your slide. That is not just specific to the live attenuated version. So knowing the difference between those two types is important. And then contraindications for both types. So I already mentioned patients with GBS, which is Guillain-Barré syndrome. Patients with a severe egg allergy or patients with allergy to flu vaccine. So these three patient populations, they should not get the influenza vaccine at all, whether it's the inactivated or the live version. Typical adverse effects that could be seen, typically these are pretty mild and transient. Cough, fever, headache, they usually go away pretty quickly. There is a small risk for Guillain-Barré syndrome, and that is a severe paralytic disease. The risk, I said, is pretty small, 1 to 2 cases per million recipients of the vaccine. It manifests as an ascending paralysis beginning with weakness in the lower extremities, but then that progresses to difficulty breathing. So this is a very serious condition, but there is a small risk for that. And so then my question for you guys, think for a moment, who should we vaccinate? Who gets the influenza vaccine in the United States? Who does the CDC recommend? So maybe pause the tape for a moment, kind of write down some thoughts on that. So hopefully you paused the tape and came up with some ideas for people who should get the flu vaccine. I came across this diagram or this pictogram, I guess, and which I kind of like. I mean, it's a little bit like tongue in cheek, um, but I think it really drives home the point of who you need to vaccinate. So if you guys aren't sure who you should be who should be getting vaccinated, take a look at this slide. It was put together by the Public Health Services nurses. I got it off of their website. So here's kind of their algorithm for who should be vaccinated. Number one, are you human? Yes. So if you're human, you should be vaccinated. Are you over 6 months of age? Yes. And then you should be vaccinated. Do you ever go out in public? Yes. So you should be vaccinated. And do you enjoy reading this chart? Yes. So again, kind of like a little tongue in cheek. I mean, their bottom line is everybody should be vaccinated unless you are a child under 6 months of age. You really need to be vaccinated. And, at a minimum, the highest risk populations need to be vaccinated. And the highest risk population are people who are at risk for severe complications from the flu. So, children, um, any kids that are receiving aspirin therapy if they're under 18 years of age. And you may remember children who get the flu who are also on aspirin are at high risk for having Reye's syndrome. So you don't want those kids to get the flu. Um, Pregnant women, elderly people, obese people, people living in nursing homes and other long-term care facilities, immunosuppressed patients, certain people with certain chronic medical conditions, like asthma or anemia or diabetes and so forth. These people are at the highest risk, but we're all at risk. And remember the whole concept of herd immunity. And even with the flu vaccine, people still do get the flu. So this is definitely something that I think you guys will all administer at some points in your career. All right, and the other vaccine I wanted to briefly talk about was the pneumococcal polysaccharide vaccine, or the PPV. The brand name for this is the Pneumovax 23. But you got to be careful because there are a couple different versions of the pneumococcal vaccine. There's also a version that's designed specifically for children. It's also pneumococcal polysaccharide, but its brand name is Prevnar 13. So it doesn't have coverage against as many um, strains. So, adverse effects associated with this particular vaccine: local reactions, fever, irritability. But luckily, this vaccine is not associated with serious adverse effects. It should be avoided in pregnancy because safety hasn't been established. Safety concern, again, mix-ups with Prevnar 13. And then like I said, like I asked before, who do you think should be vaccinated for pneumococcal? I mentioned this vaccine because it's a pretty broad base of patients, adult patients that do need to get vaccinated with this vaccine. And actually, this is one of the things that CMS requires reporting on. So hospitals in particular, and I believe clinics as well, are responsible for assessing patients for whether or not they should get the pneumococcal vaccine. So for you guys, when you're working in, whatever setting you're working in, but particularly if you're working in the inpatient setting, it's going to be part of your daily work, to assess whether your patients, if you're taking care of adult patients, whether or not they are a candidate for a pneumococcal vaccine. So who should be vaccinated? Specifically, immunocompromised patients, um, with chronic diseases, smokers, patients in long-term care facilities. These patients need to be vaccinated. Additionally, any patient older than 65 who hasn't previously been vaccinated. So it's a pretty wide range of patients, especially who you will especially see in the inpatient setting. So of the people I just talked about, most of those people are people that get admitted to the hospital, or have the potential to get admitted to the hospital. All right, and that's it for vaccines. So really this vaccine discussion was just kind of what is vaccination therapy. I talked about two of the most commonly used vaccines, the two I think that you will see more than anything else in the kind of in the inpatient or in the community setting. Now, if you work with specific populations like pediatrics, of course, you're going to see much, much more. If you work in the emergency setting, you're probably going to see several more vaccines that you may not otherwise see, like the tetanus vaccine, for example. But again, these are just kind of general principles so that you guys can all have a basic understanding of vaccine therapy. If you have questions, please post them to the discussion board, and thank you for listening.